Hello, I'm Dr. Kodlady Surendra Shetty, consultant spine surgeon at Spine Care, Magdi Road, Rajajinagar, Bangalore. Immediately after the spinal injury, the spine has to be supported. Suppose the patient may go in for surgery or he may be taking a conservative treatment. Conservative treatment means when we don't do surgery, when we treat them only with medication or with some support, then we call it a conservative treatment. So whether it is conservative treatment or surgical treatment, patient needs to take initial bed rest. So bed rest in the sense he doesn't have to sleep on the bed for a long time. So except for when there is a wedge compression fracture or fractures, dislocations of the spine. Only during such situation when we are treating them conservatively, they may have to be immobilized in the bed for some time. So, but otherwise they can be mobilized. They don't have to take total bed rest. But they should avoid lifting weights, bending forwards and long hours of journey and long hours of standing, long hours of sitting. All these things they have to avoid in the initial period. And once suppose the healing occurs, so suppose after a surgery, after 2 to 3 months, all the tissue would have healed. By that time, they should start mobilizing the spine by doing proper mobilization exercise as well as strengthening exercises. So suppose after a surgery, if they take too much of rest for a long duration, for many months together, then once again the muscles can become weak and it can produce more problems than good. So that is why we need to initially immobilize and take rest, and later we have to mobilize and strengthening exercises has to be done. So when we do all these things properly, then we can expect a better results. So these tips post-surgical patient has to take. So initially they should not carry weight or bend and lift weight. So later, once the healing occurs, once the surgeon says, okay, now it is united, there is no problem, you can go ahead and do routine work, then only you have to do the routine work. Otherwise, for initial 2 to 3 months, we should not do any stressful exercises or any work.